Hi, hello guys, welcome. I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. Welcome to Watch This Space. This is the very first episode of the short but punchy health class we're going to be having called Watch This Space. I'm very sorry about any background noise. It is very hot in my study. It's very hot today, so please bear with me. Otherwise, I'm going to be dripping with sweat within a couple of minutes. That fan has to stay on. So it may be a little bit noisy, but I've got my mic and hopefully you should be able to hear me okay. Right, so this is Watch This Space. Please give this video a like if you are part of AskAwayHealth and you know what we do. We love to share health information. This particular episode, we're looking at a quote-unquote new blood test that can help to detect cancer. And I just thought it was something interesting to bring to our attention. And I'm going to start by sharing I'm just going to start by sharing this video I want you to watch with me. I hope this is going to share because last time I don't know what happened. But if you can't see it, okay, guys. So this is what the test is. This is what I wanted to share with us. You've heard it from the horse's mouth. So let's just talk a little bit about it. Let me just mute it before it starts playing again. Oh goodness, there we go. Okay, so before it starts playing again, so this is the update. This is the update that major cancer breakthrough as world first blood test can detect 50 types of cancer. And as you've heard in the video, this is a test that's been, it's not new. For about a few years now, the research has been going on. And we've looked at some of the benefits. I think they've looked at some of the benefits. And I'm glad this also talked about some of the downsides to this test. Hi, Carl. Oh, hello, Caroline. Hello. Good to hear from you. How are you? Hope you're doing well. Thank you so much for joining in. Thank you so much for clicking on the stream. Good to hear from you. We're talking about this blood test for cancer. I don't know if you've heard about it, but let me know what you think. But I think it's pretty exciting stuff. Really exciting that we have something that can potentially indicate whether or not cancer is present. Of course, we know that sense of anxiety, that foreboding. And I think what's really interesting about what this test did, or what the research that they have, let me see if I can pull it up, was they tested people. Let me see if I can find this. Okay, yes. So they looked at people with certain symptoms that for doctors, myself included, can be a bit tricky when you're trying to work out, is this something to do with cancer or not? For example, unexpected weight loss, change in bowel habits, postmenopausal bleeding, rectal bleeding, and abdominal pain. Most of the time when people come with these symptoms, you would usually refer them as suspected cancer. You want to get that out of the way. And so people will have to go through a range of different tests. But sometimes it isn't cancer. Unexpected weight loss can be from different causes, as can changes in the bowel habits, and bleeding after the menopause. But you would definitely be thinking about cancer first and foremost. You'd want to make sure that you don't miss that when you're looking at the possible causes of a condition like this. Oh, wow. I have a colleague that was diagnosed when she reached stage 4, despite having had regular. Oh no! Oh gosh, I'm so sorry to hear that. Oh Lord, it is difficult. It is quite difficult because sometimes there might be different symptoms that may not immediately suggest. And I wish we had exactly what this test is trying to do. I wish we had something that when someone comes with a symptom that doesn't exactly pull up any red flags, you can arrange something fairly simple and straightforward like a blood test, which then tells us, is it more likely to be cancer or not? Which is why I think this is really exciting that we have a test like this. And that's really sad. And this is a classic example of why such tests are necessary. Because like you heard in the video, where you're having a test that's able to accurately indicate or diagnose that over 60% the diagnostic ability for a cancer, which was accurate. So before you even send people to do scans or send people to do other tests to indicate cancer or biopsies and so on, you actually have a blood test that could indicate that this is cancer plus where the cancer is likely to be. And the other thing as well, this relies on DNA or chromosome or genetic analysis, is able to identify certain types of tumor or cancer markers in the blood produced by the cancer, and they actually can narrow it down to the type produced by specific cancers like pancreatic cancer or lung cancer, whichever kind of cancer that they can pick out from the test. So there are lots of good things. This is a good development for medical care because early diagnosis is critical in terms of cancer treatment. If you can pick something up early, you can either try and remove the cancer, and not just the immediate area of the cancer or the immediate cells of the cancer, but the immediately surrounding organs as well. You can remove those. And then you can go for, treatments that would likely kill the cancer or give it a very low chance of coming back if you pick it up early, compared to if it's picked up at later stages, stage 3 or stage 4 of disease. So Carlin's saying here, my colleague felt a slight bloating discomfort after meals. And prior to going on her vacation, she went to her doctor. That during vacation had to be put on hold. Yeah. And that's the thing, just to go on what you're sharing here, Carlin, something like ovarian cancer at early stages can be quite non-specific, where there's a little bit of bloating, a little bit of fullness, which some people could even blame on indigestion or irritable bowel syndrome. And it is from many cases that the diagnosis has been missed, that we now sort of, if a woman comes and she's complaining about these symptoms, you don't think twice before you start looking for blood tests and scans of the pelvic area to make sure it's not an ovarian cancer, because it's so easy to miss at the very early stages because it mimics other conditions. And when you think about, for example, for us in the UK, you can't just request the pelvic scan and have it done today or tomorrow. It may be something that you're waiting a couple of weeks for. Having a blood test where you can just take a blood sample or send somebody to have a blood test done and get the results within, a few hours or days, that would be such a brilliant development. So I'm really so sorry to hear about this, this colleague of yours and their experience. And this experience is not unique to a few people. Lots of people go through it. So it's about how do we diagnose cancer early? How do we diagnose cancer effectively? These are really exciting things, I think, from this, that this test is showing us that it is possible. This Galleri cancer test, it is possible that you can get it. You can pick up certain cancers early. It says the top cancers they diagnosed were bowel cancer, lung cancer, uterine, gastric cancer, and ovarian cancer. And the researchers say they see potential for identifying people going to their doctors who are not currently referred urgently, and who need testing. So somebody who may have symptoms, you're not 100% sure, you can't tell, you're going to do some tests, they don't have the red flag signs that mean you have to refer them under the 2-week wait, as we use the system that we use here in the NHS in the UK, where they will need to have an initial assessment by a specialist within 2 weeks, have the test and all that to diagnose cancer. So these are the pros for this test. If it has the accuracy that they're talking about, and if that can even be improved, that would be fantastic. But of course, on the downside, and this is not, I wouldn't say this is a black mark against it, because to be fair, with lots of different tests, you have such things like false positives, where a test says that something is present when it actually isn't, because as you heard in the video, it was picking up cancer in certain people who didn't have it. So imagine that a person comes to their doctor, they've had this upset tummy or bloating of the tummy, and so the doctor says, let's do this test before we send you off to the hospital to get all those other tests like scans and all that. And then the test comes back after a few days and the result is positive. And imagine the anxiety, because of course the next step is that the person will be sent off to hospital to get confirmatory tests and scans and so on. Imagine the anxiety they would have to go through before they eventually have their scans and all the other formal conventional tests that tell them that, well, it's fine, that you don't actually have cancer. So I can hear people say, well, which is better? It's actually better to have a test that gives you an indication of whether somebody has cancer early, and you can manage those people who have to go through anxiety for a couple of weeks before they realize that they don't have cancer. Every one of us is different, and I think we need to be sensitive to that. I think it's awful to have to go through that, and that fear, that anxiety, that panic. And I think it is reasonable to consider that no matter how good or how accurate to some extent this test is at being able to positively detect cancer, they should also be able to do something about making it more specific and more sensitive. So more tests or more studies really need to be done on how do you make sure it narrows down, because that's quite a big number. That's quite a big number of people that it falsely said had cancer. So that's a lot of anxiety in some homes and families and so on. But there's still a way to go, because according to them, let's see, they're still doing more testing. According to Professor Lawrence Young, an expert in molecular oncology at Warwick University, this is an important study that shows we're edging towards an era when blood testing for cancer, alongside other tests of patients with symptoms, could really impact early diagnosis and significantly improve clinical outcome. And yes, he says to really trust. Okay, now let me read everything that he says. However, he warned that the test's lower accuracy when flagging cancers remains an issue, because he says the real challenge is to diagnose those cancers that are difficult to detect, like lung and pancreas, and use a positive blood test to instigate other investigations such as imaging. To really trust that a negative result on blood testing means no cancer will require more studies. Yeah. So yeah, that's true. So you send somebody who has some symptoms and you send them for this test and it comes back negative. As a doctor, how confident would I be to rely on that test alone? That does need more, that needs more thinking before we can fully rely on this. But we can see where it can have its benefits. We can see that a lot more work needs to be done. This is not a new thing per se. These are a device that they've been testing for a number of years, and so they're getting somewhere. There's some breakthrough that's been happening. So guys, let us watch this space. Let us watch this space. Carlin says, I think the science has to be perfected to be more accurate. There's no need to falsely alarm people. It is horrible. It is horrible. Lost nights, the anxiety, you can't function. It just some people just before going for a doctor's appointment, the tension, it's horrible. I completely agree with you that even if it has its positives in that it's able to identify certain types of cancer to some degree, if it has such a high false positive rate, that is a worry. So a lot more work needs to be done. I definitely agree with you. Okay, so this is the first episode of Watch This Space, and that's what I wanted to share. I saw that on the news, and I thought it was really something interesting for us to consider. As people interested in healthcare, people interested in what is the best way that we can stay healthy, our friends and families can stay healthy. So guys, thank you so much for joining. Colin, thank you so much for your comments. I'm really glad to hear from you. It's been such a long while. I hope you're doing okay. But yeah, hopefully this should be a regular segment for us on Sundays. Maybe after my first live stream, I can just quickly come on if I found something interesting to share, and for us to deliberate and just keep in the back of our minds that this is where science is taking us. What are the pros and cons, and how might it affect us and our health in the next sort of 4, 5, 10 years or so. So guys, thank you so much for watching. I hope you have a great weekend, rest of the weekend, and a great week ahead. And I will see you again. Please don't forget to give this video a like, and of course, subscribe to the channel. And I will see you again soon. Bye-bye, guys.